Hello, everyone. Welcome. Welcome. People are just coming in. It's nice to see everyone here today. Thank you all for joining us. Wow, you're all coming in fast. All right, well, most of you are here, so let's begin, shall we? Welcome everyone today to this webinar. Today we are here to talk about positive actions and the Positive Actions Initiative. And so first, let's just dive right in. Let's start with the land acknowledgement. So I myself today am currently joining from Toronto, which belongs to the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, as well as the Wendat peoples. I also want to acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. It's a fairly bright day here in Toronto today, and I know I appreciate that. I appreciate the sun and sort of all that bright energy it gives. And so no matter where you are all calling in from, I hope some of that bright energy reaches you today. Yeah, and with that, let's start off with some introductions. So hi everyone, my name is Alex Tran. I am a research coordinator here at ReachNexus at the MAP Center for Urban Health Solutions at St. Mike's Hospital in Toronto. I work on multiple HIV stigma initiatives with the team, including Positive Actions, which we're here to talk about today. I'm also a person living with HIV, and I try to use that lived experience to inform all the work we do here. And with that, I'll pass it off to James.
Thank you, Alex. Hello, everybody. My name is James Watson. I'm a research manager, and I manage the peer training and stigma initiatives at Reach Nexus. I'm also a person living with HIV and happy to be here with you. And with that, I will pass it on to Monty.
Thanks very much, James. Good morning, everybody. Hi, I'm Monty Strong. I'm the research coordinator at an organization called PAN in British Columbia. I'm also one of PAN's Positive Leadership Development Institute trainers. PLDI is a program by people living with HIV for people living with HIV. I've lived with HIV for over 22 years, and I'll be providing a positive action project update today. And thank you for this opportunity. And over to you, Sarah.
Thank you so much, Monty, Alex, and James. So welcome, everyone. Hello. My name is Sarah Switzer. I'm a senior researcher at the Center for Community-Based Research, a nonprofit community-based organization committed to participatory and action-oriented research and evaluation. The Center for Community-Based Research, or CCBR, is located in Waterloo. Although I personally live in Toronto, as covered by Treaty 13, and we are really excited to have partnered with REACH to provide evaluation support and coaching for positive action teams on this project, and thrilled to be here with all of you. And I'm gonna, well, I think pass it over to me. All right. Okay, so a bit of housekeeping information for today. So the webinar will be recorded and made available online afterwards. Please ask your questions throughout the webinar and submit them using the Q&A. We'll be answering questions at the end of the webinar, and James will be moderating that kind of segment of today's event. Closed captioning is enabled, so feel free to turn it on and off as needed, and you can devote any tech-related questions and chat moderation to James as well. And as folks are kind of now starting to trickle in and join us, we really invite you to introduce yourselves in chat. So please let us know who you are, where you're coming in from, the land that you're calling in from. Alex has already dropped into chat a link, nativeland.ca, if you need help finding that information. And it looks like we've got folks calling in from all over the place, which is fabulous. I'm just scrolling through the chat here. Welcome. We've got folks calling in from east to the west. Wonderful. And to the north as well. Okay. Just a sec, my slides are acting up for me. Here we go. And I'm got a question for you, Alex, because my slides are not acting as they want to be. Do you see the for your information slide or the agenda slide here?
Currently, it's on the agenda slide.
Okay. Well, that's all right. Tech glitches happen. So just to give you a sense of what we're going to be doing today, we already started with the land acknowledgement and introductions. We'll have an overview around the positive actions, talk a little bit about HIV stigma, peer leadership, engagement, peer engagement and peer leadership, spend some time with the kind of the proposal so that you can be guided through the proposal itself and the application process, and then really spend a lot of time talking about next steps and your questions. Okay. And Alex, I assume it's the for your information slide.
Yes.
Yes. Okay. What I'm going to do, I'm just actually going to stop sharing and then reshare because for whatever reason, the slides on my end are shuffled. So just a moment. It's a tech glitch here.
Okay.
Thanks everyone for your patience. Okay. And Alex, which slide do you see now?
For your information.
Okay, great. All right, so we're all shuffled now. So we're going to start off with a bit of an exercise. We're really curious to hear from all of you. How many of you already have a positive action in mind? So you'll see on the slide, we're using an application called Slido. All you need to do is pick up your phone and scan using the QR code at the top left-hand corner. If you have trouble with this, you can also join at slido.com and enter the code 1133519. So scan the top bar here and tell us, do you have an anti-stigma positive action project in mind already? The questions are coming in live, or the votes are coming in live. Just give another 10 seconds. Fantastic. So it looks like about half of you in the audience already have a project in mind already. Terrific. We hope this webinar will be a space to kind of get some clarity on how you can kind of submit the best proposal ever. And for those of you who are still trying to figure it out, that's okay too. We're going to be talking more about what a project might entail today to give you a bit more inspiration, as well as hearing from one of our previously/currently funded projects. And for those of you who are still looking for inspiration, great. Tune in and we'll be talking about lots of ways you can get support. All right, over to you, Alex.
Thank you, Sarah. So positive actions. What is a positive action? Well, I will tell you exactly that. Next slide, please, Sarah. So a positive action, well, a positive action is an intervention, and so they both aim to promote health at either a local level or a national level. They also look to address the different factors that impact our health, and they do this by creating some sort of change. However, with discussions with our community advisory committee, we ultimately decided to adopt the term positive action rather than intervention, simply because it just fit better with our vision and our values. And so within this initiative, we are looking to create positive actions that focus on reducing HIV stigma. And on the next slide, you'll see more of our goals in more detail. And so, like I said, overall, we are looking to reduce HIV stigma, although there are some other goals that we're hoping to achieve through this initiative. And so while I go over these goals, I invite everyone to think about how your potential positive action may meet one or more of these goals. And so first, we hope to change attitudes and behaviors to reduce HIV-related stigma where it happens. We hope to change policies and practices that stigmatize people living with HIV in healthcare settings, workplaces, and community organizations. We hope to ensure that people living with HIV can access culturally safe and stigma-free services. We hope to improve the health of people living with HIV. And we also look to build the capacity of people living with HIV in becoming stigma reduction champions. And so those are a bit of the goals that we're hoping to achieve through this initiative. On this next slide here, there's a bit more on what the funding opportunity entails. And so for this initiative, for this upcoming cycle, we are looking to fund about 3 to 4 positive actions. And so these grants are about 1 year in length, and each positive action can be funded up to $20,000. This year, we're hoping to fund a positive action focusing on reducing HIV stigma in healthcare settings. And so one grant will be dedicated to a positive action with this focus. The proposal will still be required to go through the appropriate review stages, as all other applications are required to. And I will speak to this review process a bit more, but essentially this year we're looking to fund 3 to 4 positive actions, 1 year in length, $20,000 in funding, and one specifically for healthcare. Next slide. So before we dive into the proposal walkthrough in the later half of this webinar, I want to go over some of the key elements that are important to the Positive Actions Initiative. So first, I'm going to talk about HIV stigma. And I'm sure many of you here are familiar with the different types of stigma. But for those who may not be as familiar, HIV stigma refers to negative attitudes and beliefs directed towards people living with HIV that significantly discredit them in the eyes of others. And so breaking this down further, there are 3 types of stigma that I would like to go over. The first one being enacted stigma. So this refers to acts of discrimination towards people living with HIV due to their HIV status. And so an example of this would be people have physically backed away from me because they have learned that I have HIV. Another type of stigma that we commonly see is anticipated stigma. And so this refers to the expectations that other people would treat you badly because of your HIV status. So an example of this would be, I worry that people may judge me when they learn that I have HIV. And then lastly, we have internalized stigma. And so this is the agreement with negative thoughts or feelings around HIV and applying them to yourself. And so an example of this could be having HIV makes me feel dirty. And so stigma, as we know, affects different parts of our lives very greatly. And so, for example, it can affect your physical health, mental health, ability to access healthcare, ability to form social relationships, and even more. So on the next slide, we have another Slido activity. And so what I want everyone here to do is imagine your positive action and think about what part of stigma and health that you would like your positive action to focus on. So for example, this could be physical health and stigma, mental health and stigma, access and care, social relationships, or even all of the above. And so like the beginning, feel free to scan the QR code and go to slido.com or use your phone, enter the website, enter the code, and participate. I already see that we have some responses incoming, which is great. Okay, so far half we're looking to improve access to healthcare. Oh, we're evenly split. I love that this is live, Sarah. It's very I don't know, it's cool. It's like I'm watching a show or something. Oh, I have to move my mouse. Oh, okay, social relationships, healthcare. Okay, a few people are looking to do all of the above, which is great because everything's so intertwined. So that does make sense as well. All right, so I think we'll leave it there, but it's great to see how everyone's already thinking about what facets of stigma they're hoping to tackle through their positive action. So this is great. This is great. Thank you, Sarah. So next, I want to talk a bit about peer engagement and leadership. And so this is another key component of positive actions. And so in this initiative, we define peers as people living with HIV who are hired into roles where their lived experience is essential to the work. Most importantly, peer engagement should be meaningful to the person and to the project. And so, what does this look like? Well, ask peers what their interests are and what skills they would like to develop. Support peers to take on prominent leadership roles. Involve peers in decision-making processes. And this is an important one to me. Avoid tokenizing people living with HIV. And so I think these are some key values to take into account when sort of planning how to involve peers within your positive action. Next slide. So how exactly can you involve peers into your positive action? Well, you can do it in many ways. For example, you can create a committee of peers to guide the development of your positive action. Supporting peers as committee members is really helpful as it gives you access to a group of people to validate your project and guide your project. Peers can also be involved as team members, and so these are paid employees in leadership positions or other staff positions, such as project manager, project coordinator, research assistant. But no matter the position, we recommend that peers be financially and equitably compensated for their contributions. Peers can, sorry, I was just going to go through. Peers can also be involved as evaluators, helping to evaluate the outcomes of the positive action in ways that are respectful and appropriate. They can also be involved in knowledge sharing activities, such as delivering workshops, webinars, or other creative ways of leveraging their talents. And finally, peers can also be incorporated into other specialized roles, for example, for specific skill sets like graphic designers, marketing consultants, stuff like that. But yeah, hiring peers in these roles are an important way of sort of showcasing the lovely work being done by people living with HIV. And on the next slide, I will talk a bit about peer leadership. So these are just a few key points to take into consideration that we would like to emphasize. So centering peers in leadership positions really puts JIPA and MEPA into motion. Through peer leadership, we are able to enhance the capacity of people living with HIV to become sort of stigma reduction champions or activists. Leadership does not always have to be at the front, and that's one that I find especially that I resonate with really. And ensure principles of equity are considered when supporting and fostering peer leadership. Next slide. So here we have some of our currently funded positive actions, and today we have the honor of Monty from PAN here to sort of give us an overview of their positive action and sort of lovely work that they're doing. So Monty, I will turn it over to you.
Okay, thanks, Alex. So PAN's positive action project is based on what we heard from a couple BC small urban, rural, and remote peer harm reduction workers that we've worked with on another project. And what we heard is that sometimes, or many times, HIV is not a common topic of conversation in harm reduction services, and that one of the main reasons is due to stigma. So what we here at PAN will aim to deliver in our positive action are the following three things, not in chronological order as they will be produced. But so first, early year 2025, we will launch a publicly available online workshop toolkit that will contain different sections of resource information about stigma, HIV, and specifically with the picture of harm reduction in small urban, rural, and remote communities. The sections will contain relevant web links to web pages, downloadable documents. The sections will also contain quick look text summaries, maybe sometimes downloadable summaries. The kit will also contain information on how communities can host their own positive action workshop, preferably in person, but they could do one online as well. Secondly, also in early 2025, we want to host an online training for people living with HIV who work in SIR areas in harm reduction. The purpose is to take them through the content of a workshop for them to experience it themselves so that they can get a sense of what they might be delivering one day. And then we plan to have a component of train the trainer as well, right? And I'll also be recommending to PAN that an online training be offered in another session to people who work in harm reduction who don't necessarily live with HIV to reach as many people as possible. Thirdly, we will be delivering 2 in-person workshops, one in Prince George and one in Quesnel. Both are part of Northern Health Authority here in British Columbia. I'm flying there tonight, and the workshops will take place this week. Each workshop is 2 hours long, and it will be interesting to see if I can fit everything into those 2 hours, because we've created a lot of content and exercises to engage them in the subject matter of talking about HIV and stigma. We will also be gathering evaluation data from these 2 in-person workshops to help us gauge what we might change ahead of the online training in early 2025. One of the guiding messages is that there is a path in local communities to eliminating HIV in small urban, rural, and remote communities, which involves capacity building, reducing stigma, moving on to prevention, testing, treatment, and ongoing care. And if those aren't, of course, sequential steps, those are all happening at the same time. One way we've been gathering what's important to have in the workshop is convening a steering committee to hear their perspective and documenting their input, and then incorporating their input into the workshop kit content. And it's also a good opportunity for them to participate, build their own capacity as a steering committee member. We've seen a couple committee members really open up and come out of their shell. And actually, one of them will be a workshop assistant with me at the Quesnel workshop session. Thank you very much.
Thank you, Monty. Thank you for that lovely overview. It's always good to hear such the progress that's going on in each of the teams. And I'll also just touch a bit upon the other 2 projects we have going on. So the first one is the Young Women's Stigma Reduction Project, led out of Women's Health in Women's Hands. And so they are looking to reduce HIV stigma and other forms of stigma among a group of young African, Caribbean, and Black women living with HIV. And they're doing this through cohorts of ongoing workshop series. And then we also have the Digital Storytelling Project from the United Voices of HIV Alberta. And they're leveraging the creative method of digital storytelling to facilitate more open conversations about what it means to be living with HIV in their community. And you can learn more about these projects on our websites under the Meet Our Funded Positive Action section. But yeah, lovely work. Next slide. Right, and so more lovely work, but I'm a bit biased, but this so this was developed from our team last year. And this Positive Actions e-module contains a lot of resources, including stuff on HIV stigma, peer leadership engagement, all the key elements I mentioned earlier. And so I believe James will be dropping a link in the chat. And I highly suggest that everyone check this out, either in preparing for their submission or just, sharing it amongst other people in your networks. There's a wealth of information in there for sure. Alrighty, so why don't we move on to our next section? So the next part of the webinar will be walking through sort of the different components of our proposal template. So we understand that writing proposals can be challenging. I certainly can identify with that. And so we want to take some time to let everyone know sort of what's expected in each section. But there's a lot of buts from me today, I feel. Before that, we're going to pass it off to Sarah for our final Slido activity of the day.
Thanks, Alex. Okay. We recognize that a webinar, it's hard when we can't see everyone's faces in the room. And so we wanted these kind of moments of interaction to mix things up in addition to the chat box. So for those of you who said, yes, I have a positive action in mind already, our team does, or maybe you were a no, but suddenly, inspiration has struck after hearing from Monty at PAN and you've got a new idea. We are curious, what is it? Tell us about it. Describe the essence of your positive action in 7 words or less. So this can be really, really simple. Maybe it's a podcast with folks living with HIV. Maybe it's offering peer-led support. Maybe it's workshops. Maybe you don't know what you want to do yet, but it's going to involve art in some way. Who knows? The sky is the limit. So if you're new and you're joining us now, you're going to pick up your phone. You're going to scan the QR code by opening up your camera app. If you can't do that, you can also log on to slido.com and do the code 1133519, or you can enter into chat and toggle to everyone if you're struggling. So we'll just give folks a moment to complete the poll. And I'll read out some of the things in chat, just so we can get those voices onto the recording. Two-Spirit Men and Families of Biology in rural Alberta, a women-centered hub for collective discussions and residents with other women affected by HIV. So thanks for those of you who just entered that into the chat. Okay, and look, we've got lots on the screen now. Clinic visits with health teams, PAWS Youth transitioning to adult care, working with Indigenous communities, IPHA empowerment through traditional healing practices, positive action research with Calgary people living with HIV, the first archival and current PAWS artist comprehensive exhibition. Oh my goodness, there's so many here. And I'm going to scroll down so we can see some of them. Indigenous beading and talking circles for PAWS women, documentary style short videos, peer-led support navigation. So many. So wonderful. Thank you, everyone. These are fantastic ideas, and can't wait to hear more about them. All right, so I'm going to pass it back to Alex.
Thanks, Sarah. So the first section of our proposal template is just an introduction. So really, this section is to help the review committee determine if your positive action has been implemented, and if so, where, and maybe a bit about how that implementation went. It's also a place for providing background information in terms of information that's needed to understand the proposed project and how it aims to reduce HIV stigma and address any other issues. We also suggest noting down any gaps that your positive action might hope to address. And also, please ensure to include the goals of your positive action. And the clearer the goals are, the better. Next slide. So the positive action plan section incorporates multiple elements in it. So first being, what is the strategy of the positive action? And so, for example, will you be hosting workshops, creating support groups, creating educational material, delivering presentations in healthcare settings? So really, this is the place to let us know. And in the proposal template, you will also be asked to identify sort of which key populations that your positive action hopes to engage with. So please be sure to note that as well. And then in terms of collaboration, the review committee will love to know sort of what existing partnerships that your team may have, or what new partnerships that you foresee will develop through your positive action as well. So just some key elements to keep in mind. Next slide. Intersectionality. So for those who may not be too familiar, intersectionality is a framework that sort of takes into account the intersections of different identities and how that interacts with the world around us. And so, for example, my experience with living with HIV will not be the same as someone else's, simply due to the fact of who I am. And so in your positive action, or in the proposal template that is, we would love for you to outline how your proposed project sort of takes into this into account, takes into the elements of intersectionality alongside principles of equity and inclusion. Additionally, please also let us know how your positive action might incorporate a face-to-face in-person element. And then lastly, please also describe sort of where your positive action hopes to reduce HIV stigma. So is that in a healthcare setting? Is that in community-based organizations? Are you going out into the general community? Are you reducing stigma between relationships? Or perhaps the main focus of your positive action is to reduce feelings of internalized stigma. But no matter what, just make sure you're clear in letting us know sort of what your goals are. Peer engagement plan. So I want to place an emphasis really that the review committee will be looking for proposals that place peers and sort of facilitate the growth of people living with HIV to be in leadership positions. And so when writing your proposal, it should be clearly explained as to how peers will be leaders or how they will be built to become leaders through the positive action. Please also describe how your project aims to recruit peers and any training and support that you will be providing to your team. And then lastly, please also be clear in explaining the roles and responsibilities of your different team members. So specific project activities. So in this section, what the review committee is expecting is for you and your team to list out the different activities that will be going on within the positive action. And not only that, but also explain how each of the activities contribute to the success of the positive action. And so when writing this, please also include a timeline. So that's like a start and end date for each activity. And then lastly, it'll be essential to sort of map out whose role it is for each activity as well, just to paint a clearer picture for the review committee. And I believe next is evaluation. Right, and so Sarah, off to you.
Thanks, Alex. All right, so this project, the Positive Actions Project, is funded by the Public Health Agency of Canada, and which requires the Positive Action Project to complete an evaluation of the positive actions. So for this project, REACH will be leading the evaluation, and the Center for Community-Based Research will be providing support to both REACH as well as the Positive Action teams, and I'll talk about that in a little bit. So the REACH core evaluation will examine a few different things, but really kind of foreground on experiences of HIV stigma, experience of participating in and leading the positive action. So both will be connecting with both participants and teams, and REACH will also collect demographic information for positive action participants, as this is required by the funder. So this is the REACH evaluation. In addition to the REACH core evaluation, each positive action team is invited to explore evaluation questions that are unique to your own particular positive action. And I'm going to explain this in a moment. Okay. Before I do so, a little bit more on the method. So in order to meet the evaluation goals, once funded, positive action teams will work with REACH vis-a-vis Alex, the fantastic coordinator of this project, to kind of do the following. So one, conduct pre and post surveys with positive action participants. And the surveys will ask questions about demographics, changes in experiences of HIV stigma, cultural safety and overall health, changes in leadership capacity. Okay, and so by pre and post, I mean there'll be a survey at the beginning and a survey at the end. REACH will also be carrying out pre and post surveys with the teams that are leading the positive actions, to ask some questions about team member roles, as Alex mentioned, really thinking about kind of peer leadership here, and capacity building, and we'll ask some questions as well about descriptions of the positive action and changes over time from the team perspective. All right. Finally, once your positive action is wrapped up and you've all done amazing work in your community in terms of the funded projects, REACH and CCBR will conduct a focus group with team members, so not participants, but with the teams, to invite you to reflect on the team's positive action and the difference it made in your community. So to be extra clear here, REACH is requiring funded teams to work with kind of REACH to collect the information. However, REACH will be doing a lot of the heavy lifting, so designing the tools and analyzing the data. However, in addition to this core evaluation, project teams are really encouraged to consider adding your own unique evaluation questions and methods that are unique to your particular project. All right. So the application will ask you to consider what questions you want to explore as part of your positive action specific evaluation. These questions are separate from the REACH core evaluation that I just mentioned. And the reason that, the application is asking for this is that evaluation can be a really helpful way to reflect on what's working well or not working well in a positive action. Evaluations can help capture the impact of a project for your own learning or for future program funding opportunities. The goal here is that it should be useful and a space for kind of reflective dialogue, essentially. So given this, we really want to encourage you to reflect on what you might want to learn as you roll out your initiative. This does not have to be big, okay? And we really encourage teams to start small. You can think of evaluation, if you're new to evaluation, in two buckets, if you will. So there's process evaluation, so studying kind of how the positive actions rolled out or the implementation of it or the activities, or outcome evaluation, the difference that it made, right? The impact that it had. And when planning your positive action and as you're preparing for the application, you might consider meeting with folks that you're working with and folks in your community to really think collectively to make it participatory. What do you want to learn as you roll this project out? So I want to give you a brief example just to kind of make this really concrete. United Voices of HIV Alberta gave us permission to share this example. So they're one of 3 of our funded positive action projects this year. As Alex mentioned, you can read all about them online. And they were funded to implement digital storytelling workshops on HIV stigma with people living with HIV. Now, the REACH core evaluation tools have many questions about stigma and peer leadership, but they don't ask about digital storytelling, right? And so this particular project, they had a lot of questions about digital storytelling on 2 levels. One, what they needed to know to plan the digital storytelling workshops, right? The process of conducting the positive action. And they also wanted to know about the impact digital storytelling had specifically on stigma. So your project might have questions about the specific approach you're taking as in your project, or you might have specific questions about the communities that you're working with and working alongside. So once you know what you're interested in learning, right, you might want to consider your method. So how will you go about answering these questions? And for those of you new to evaluation, I'll break this down really briefly. So there's 2 types of kind of methods buckets you could consider. Quantitative methods, so these are where data is collected and analyzed numerically. These methods are designed to go broad, to collect a lot of information across a large group of people. Take, for example, the pre and post surveys REACH will be conducting with all positive action participants and teams over the years. Qualitative methods are a bit different. They're designed to go really deep and collect information or stories from a smaller group of people. And qualitative methods like interviews or group discussions or arts-based methods, they're designed to kind of get at the how or the why, information that requires story and context. And so an example of this are the focus groups, the group discussions that REACH will be conducting with all positive action teams at the end of the project. So for your particular project, you might want to consider how you'll answer your evaluation questions you have with respect to these kind of 2 buckets. We really encourage you to keep it simple. Remember, you can draw on REACH's tools that we already have in thinking about this question, all right? But you might have new methods you want to add to the mix. All right, so for example, just to make this really concrete and really simple, because we want this process to be accessible, you can propose 2 or 3 unique survey questions to add to the REACH survey, that will be answered by your positive action teams only. Right, so that's one example. And so to crystallize this even further, the example I shared before with United Voices of HIV Alberta, for the pre-survey, they wanted to know what motivated people to sign up for the digital storytelling workshops. What were they hoping to get out of the workshops? Did they have any questions or worries or fears or concerns? And so we were able to add those questions to the pre-survey, all right? Just as an example. They also wanted to know, after participating in the digital storytelling workshops, how has people's understandings of their own HIV story changed over time? that's a really big question that requires time to talk about and care to discuss with a group. And so this question would be really hard to answer in a survey. And so for this question, they decided to use a kind of group discussion model where it was more like a focus group to explore this question, right? So really here, the goal is keeping it simple. That's the big message here. Now, if you're totally new to evaluation and you're still stuck, we are here to help. You can check out the evaluation section of the Positive Action e-module for more information. You can reach out in advance of the deadline to Alex at Reach, who will also problem solve with you around what you might need. And then for funded teams, the Center for Community-Based Research will provide community-based evaluation training and 2 to 3 coaching meetings once the projects roll out. So we'll guide you along the way so that you can be supported to roll out your own community-based evaluation in a way that's participatory, community-based, and action-oriented. All right, over to you, Alex.
Thank you, Sarah. Like Sarah said, we are here to help. So please do not hesitate if you ever have any questions. Right, so this last section of the template is the budget. And so we are asking teams to provide a breakdown of the budget, including itemized expenses, income sources. So this includes positive action funding, as well as any external funding you may have or any in-kind support you may have. And also a justification for each of your itemized expenses. And so to make this a bit clearer, Sarah, if you flip to the next slide. So we have a template here for the budget, just because, you know, sometimes creating budgets can be challenging. And so this is just one way of presenting information. If you have another template that you or your team know of or uses, feel free to use that, but this is just one of many. So just walking through it. So at the top here, we've just listed our sources of revenue. And then within the table, we have a row for personnel costs, category for project expenses, category for other project costs. And so you'll see the itemized expenses on the left with the according sort of total that each of the itemized expenses correlates with within the middle column. Within the justification column, we've sort of broken it down. It's sort of like doing the math to sort of show how you got to the total number in the middle row. So for example, if we just take pure salary costs, we see 6,200. And so this 6,200 is a culmination of training and implementation, as we see in the justification column. So that's 2 peers at $25 an hour, at 16 hours of training, and then in addition to sort of the same similar math within under implementation. So you're free to sort of take this template and apply it to the same for your own project. It's embedded within the positive action proposal template. But if you find something else that works better for you or your team, you're more than welcome to use it as well. But yeah, I think that brings us to next steps. Is that right, Sarah? Awesome. So next steps, what do we do now? So the slide here presents sort of a timeline of the process. So the proposal deadline is January 10th of next year. And so following the submission, your proposal will undergo 2 reviews. So the first one being a relevance review. And so this is just a quick review to ensure that your proposal aligns with the goals of the Positive Actions Initiative. And if the reviewers at this point have any questions or points for clarification, they will reach out and you will have a chance to sort of respond to any questions. Everyone will be notified if their proposal passes the relevance review by January 31st, and all proposals that pass will move on to full review. And so it's the same proposal. So again, this is a 1 proposal submission. It's just 2 review processes. And so in the full review, your proposal will undergo a more in-depth review by our review committee. And after that review concludes, we aim to provide the notification of results to everyone by February 28th. And for those successful teams, the anticipated start date is April 1st of next year. And then for 1 year, 1 year long grants, the end date would be the following March 31st of 2026. And so my advice really, and really all of our advice is to, start early, start as early as you can, just to allot some time for any questions you may have. Like Sarah said, I'm here to support, we are here to support if you have any questions regarding the initiative, the template, the process. My contact information is down here. And again, I suggest everyone refer to the website for some additional resources. The link to download our templates, our funding overview document, as well as our scoring rubric are all available on the website. Access to the e-module is also available on the website. And yeah, I suggest everyone go take a look at them. And then I just want to end off again by emphasizing I am a resource. Please do not hesitate to contact me. And yeah, a recording of this webinar will be made available. And then a communication will be sent out to everyone after that has been done. So I think that's it in terms of the slides. So maybe I'll close it off and we can move to questions. And so I'll pass it on to James to sort of lead us through that. James?
Hello, everybody. So thank you. We have a few questions here. So Ken is asking, can our team span 6 months instead of 1 year if that is as long as the program takes? Alex?
Yeah. So yes, of course. 1 year in length is sort of just the standard length of the grants. But if your proposed project operates under 6 months, 8 months, that is fine. You would just note that in your proposal. And it's just something that our review committee would also take into consideration. Yeah.
Great. Jax has asked, will that budget slide be made available then?
Yeah, I mean, I can send out, I can sort of review the slides and then send them out in a follow-up communication to the attendees. The budget slide, the information on the budget slide is also available in the template, but I can send the slides out in a PDF, no problem. Yeah.
Great. And Adrian asks or mentions that stigma looks different for different populations. So do we need to unpack how the affected population is impacted in detail?
I think the reviewers on the review committee are pretty well versed into stigma and their impact. So I would still outline those effects in regards to this specific key population. Right. I guess a good amount of detail.
So, and Adrian follows up, and this is a good question. So if you want to operate this positive action within an existing PHAC funded program, will that be allowed? And I'm not sure.
Yeah, I would have to take that back and sort of, I would have to get back to you on that.
Sarah, do you have any thoughts around that?
I would say this is a reach question, so I'm not sure.
So we will get back to you, Adrian.
Yeah.
For sure.
Good question, though. Yeah.
There's also a question from Lori, saying, so the pre and post surveys with participants will be okay. So the pre and post surveys with participants, I guess who will be sending out that survey? Will Reach be sending out that survey?
Right. So I guess it really depends on the positive action. So for example, we have teams that sort of I send out. So the software we're using to administer the pre and post survey is Qualtrics. And so for some teams, I have been sending the surveys out from my end, just because it was easier that way. But I know for other teams, they've decided to implement paper surveys instead, just because of the nature of the positive action. And so in those cases, I would provide a paper version of the survey to the teams, to which then they would administer to their participants, and then later just manually enter the data back onto Qualtrics.
Okay. And I see your follow-up there, Adrian, so I am going to get back to you about that. Okay, so here's a comment really here. So interesting question came up recently. People living with HIV as board members advocating for compensation because of their status, despite bylaws and ONCO, which I think is the Ontario Nonprofit something association. Oh no, Ontario Nonprofit Corporations Act, stating otherwise. So how have organizations stick handled these scenarios? So I don't think we've really come across that because the boards, as far as we know, at Reach are not directly involved with the positive action. So we haven't really come across that scenario. That might be something you might want to put to Monty or somebody who's directly involved with the community organization. But it's also Ontario, so it's not British
Right.
Columbia related. Yeah, so I don't know that we can directly answer that question. Are there any other questions? I don't see any more in the chat. And any more, throw them in the Q&A. Happy to respond. If not, reach out directly to Alex. I've put his information in the chat as well. And I guess we can end it there unless anybody has anything else to say.
There's a new question in the chat, James.
What is the max amount of funding? Yeah, so the max amount of funding is $28,000 for the grant. Uh, 20K, yes. No problem. Yeah, I mean, like James said, if anyone else has questions, feel free to email me. Other than that, there is a post-webinar survey that I would appreciate if everyone took a few seconds to fill out. It just helps us learn who we're reaching and how we can better improve. But yeah, thank you everyone for attending today's webinar, and I can't wait to see the submissions that we receive for this upcoming cycle. And just have a great day. Yeah. All right. Bye, everyone.